Good evening. I'm Barbara Sarah. I'm the coordinator of the Oncology Support Group program here at Benedictine Hospital. And this evening, we are presenting one of our monthly complementary medicine discussion group meetings. Tonight, we have been privileged to invite 4 people who are going to tell us about their journeys to healing. These are personal stories of people who have gone to foreign countries for cancer treatment. We're taping this evening so that we can get this information out to others and to share the stories of these people. There are many people who would have liked to be here tonight, but either the weather or the distance kept them away. Our last speaker before the question period is Richard Panman. Richard is a professor of psychology at SUNY New Paltz and was first diagnosed with gastric cancer 3 years ago. I believe he's going to tell you his story about his treatment at a hospital in Manhattan and his recurrence. He has been to Japan twice now for treatment with Dr. Maeda, and he's also going to tell you about how he's making efforts now to make this treatment, which has been used in Japan for 20 years, how he's trying to make it available here. It's my pleasure to introduce my dear friend, Richard Panman.
Konbanwa means good evening in Japanese. Learn a little. You have to get with the language when you go overseas and abroad. I standing before you and have a tumor in my abdomen. It's about 6 centimeters by 5 centimeters. It's about that big. And it sits on the tail of the pancreas. I think of myself as a healthy person with a tumor. I don't look bad, do I? For somebody with a tumor that size. I wasn't always this good either. Let me start at the near the beginning. May 1996, I went to my family physician complaining of difficulty swallowing my food. He examined me. He said, let's send you to the hospital for a CAT scan just to check, make sure that there's nothing else there. I did go to St. Francis Hospital. He got the report that said it's negative for cancer, there's no tumor. 3 months later, I was losing weight and I couldn't eat my food. And I went up to Albany Medical Center where a doctor examined me and did blood work and said, you know, you're anemic. Your blood work is, there's something suspicious here. You have to get this evaluated further. I went back to my family physician and he said, okay, let's do an endoscopy. That's a flexible tube down the esophagus to look into the stomach. And to see whether there's any growth in there. This, by the way, is a procedure that is done routinely in Japan as part of an annual physical screening. And it costs $100 in about 20 minutes in a doctor's office in Japan. And here it's, well, when you add up all the costs of the operating room and the doctor's fees and the treatment and the nurses, it's about $3,000 or $4,000 and takes half the day. So I'm not sure who decided on that, or how they determined the protocol, but it can be done in 20 minutes. In any case, they found a tumor. Did an endoscopy. They found a 10-centimeter tumor. 10-centimeter tumor is the size of a softball, and I have a softball at home, but I don't bring it, you know, I'll just toss it to you so that you know what it is. I mean, it was at the GE junction, the gastroesophageal connection, the connection in the stomach, just below the esophagus, and that was what was preventing food from dropping into the stomach. It was being blocked by the softball. But cancer is not a softball, it's a hardball. So, you know, I heard some of the things that my colleagues here on the panel had to say about their experiences and My wife and I looked at some of those. We considered going to the Gerson Clinic in Tijuana, Mexico, or one of the other 15 or so clinics that mostly deal with metabolic approaches to treatment. And, for me, it's a matter of belief. And I don't know what it is for you, but for me, it's what you believe in, because that's where you're going to get your best shot at success. If you don't believe in what you're doing, it's not going to work for you. It doesn't matter what it is. I had a friend many years ago had a tumor in his spine, and the doctors told him that, go home and put your affairs in order. And he went to Club Med in Martinique and took LSD with a Zen monk, and came back to New York and decided he was going to do silver mind control and eat all the Twinkies he wanted to. And he survived, and a year later went back to the doctor, and they did a myelogram, put him on a table, and lo and behold, there was nothing there. And so he started to tell the doctor what he'd been doing all this over this past year. The doctor walked out of the room. I don't want to hear it. It's not part of the 3 legs: chemotherapy, surgery, radiation. We don't know about it. That's what you call tunnel vision. That's what you call arrogance. That's what you call smugness. That's what you call American doctors. At least I do. Anger is really important to have. You have to be in touch with that. You have to be in touch with the fear. There's a lot of fear when it comes to cancer. Fear of dying, fear of living. Because if you live with cancer, you suffer, potentially. And we eventually went to Memorial Sloan Kettering Cancer Center, MSKCC. Number 1, U.S. News and World Report. Found the best doctors in New York Magazine. Best surgeon. Look, they're doing the best they can. They're doing what they know. It's just not enough, from my perspective. So I went through 4 courses of chemotherapy. I had 5-fluorouracil, and I had cisplatin. Cisplatin is a kind of drug that wrecks your kidneys. You have to be completely hydrated so that you're always getting fluids in order to prevent kidney failure. After the first course, no problem. This was easy. No side effects. Second course, a couple of mild side effects. This stuff is cumulative. It builds in the body. By the 3rd course of treatment, which was every month, once a month, I'd go for this, I was sick. I was really ill. I lost my hair. Well, that's nothing. It destroys fast-growing cells, your hair cells, epithelial cells in the mouth. I had mouth sores. My mouth closed up. My throat closed up. I couldn't swallow. I couldn't eat. I couldn't drink. I was hospitalized for 4 or 5 days until it resolved itself. Look, that's the light stuff. It really is. The heavy stuff is what happens if you don't do it. So I had 4 courses of this. They had planned on giving me 5, but they said there's a fine line between killing the cancer and killing the patient, and you're at that line. So we're not going to give you 5 courses. We'll only give you 4. And they were very nice. They dropped the dosage back by 20% after the 3rd. So on the 4th, I wasn't getting very sick. I had a great response. My body responded to this. I was always good with drugs. And the cancer got reduced by 70%, from 10 centimeters to 3 centimeters. Wow. And they were very happy. The doctors were overjoyed. Great response. I said, well, can't we go on and get rid of the whole thing? Well, that's when they talked to me about not giving me a 5th course because it could kill me. I said, all right, well, if that's what it's going to might happen, we'll go with the surgery, now. So they felt very confident that they could get the cancer out and get rid of it. Every time I had chemotherapy, I had, blood work, and my white blood cell count would drop to 900, 800, well below 1,000. Normal is about 3,500. to 8,000 or 7,000. So, you know, I was ready to be infected by whatever disease there was floating around. And for some reason, it didn't happen. Well, I know what the reason was. My wife kept people away from me. If somebody coughed, she would hustle me to the side. Or she'd, would you cover your mouth, please, you know? Or could you leave the area so that you don't infect my husband? And I was amazed. I said, that's what I need, somebody who's going to take care of me that way. You know, it's like steering people away. I got on a plane. That, you know, when you get on a plane today, you're breathing in everybody else's germs. And invariably, you get off the plane with a cold. And that happened to me several times, but I survived. So I had surgery. It was about 7 hours. Probably the most frightening part of the whole business was waking up in the recovery room with a ventilator over my nose and my mouth. Nobody had told me that that's what they were going to do. Nobody had told me that they were going to put a ventilator on me, and I knew nothing about that. I'd never had any major surgery. And so when I woke up, I had this nurse telling me that, Mr. Panman, you have to breathe. You have to breathe on your own, Mr. Panman. I couldn't respond to her. You know, there was nothing I could say because I couldn't speak. And if you don't breathe on your own, you're going to have to be on this ventilator for quite a while. And it was like I wanted to grab her and strangle her. That was what I felt like. I couldn't do it. Physically, I couldn't do it. Anyway, I survived that. I survived 10 days of not eating food in the hospital, and the reason was that they didn't want me to possibly infect my stomach with food because they took out 2/3 of my stomach. Left me 1/3, which is good. Let me tell you, because there are a lot of people who have gastric cancer who have no stomachs whatsoever. They took a little piece of the esophagus. There's a little valve, you know, at the bottom of the esophagus. Food drops directly into the stomach. So I take medication. I do this. I do that. The recovery was kind of difficult. I had some more chemotherapy to get rid of any errant cancer cells that might be in the abdomen. So they told me. And I was cancer-free for a year because my treatment ended in April of '97, and I went to the doctors, and I had 3-month checkups, and a 6-month checkup, and a 9-month checkup. And then at 12 months, they looked at the CAT scan, and they said, you got another tumor. And that's the 6x5 that I have now. And then they said, there's nothing we can do for you. We can't do surgery. We can't do chemotherapy. The only thing that we could do for you is to recommend that you get radiation treatment. So why don't you do that locally? And you don't have to come back for any more consults. And so I asked the surgeon, I said, isn't there any place in the world where there might be another treatment for gastric cancer that's better than there is here? I mean, after all, it's not that common here. It's number 17 on the list of cancers. You know, less than 1% of all cancers on an annual basis are gastric. About 12,000 a year in the United States. I said, you know, maybe, I mean, I think in Asia, in Korea, in Japan, aren't there, you know, better treatments there? He said to me, there are no better treatments anywhere in the world that you can get here in the United States. In other words, he was telling me at one and the same time, you're going to die, you're terminally ill, and nobody can treat you any better than we can, and we can't treat you. So, what do you do when you're terminally ill? Well, some people go home, crawl under the covers, pull the covers over them, get depressed, stay there and wait to die. I did check out radiation. I went over to the Vassar radiation oncology unit, and I spoke to the doctor there, and after much tugging and pulling and requesting and asking, I got the odds. I got to know what the odds are. I got to know what the data is. And the odds were roughly 100 to 1 that I would survive. And that if I did survive, we're not talking about survival in the sense that you'll be cured. Survival in the sense that, well, you'll live another 6 months, but it won't be pretty. The quality of your life will be much reduced. I said, fool me once, shame on you. Fool me twice, shame on me. I'm not doing that again. These guys don't know what I know. They don't know anything. They don't know anything. Barbara Sarah led me to Pat McGrady, who's a fellow out in Port Ludlow, Washington, runs a service, and for a fee, $400 for a 10-day report, $550 for a 3-day report, and you can get a report from him of various treatments for your particular type of cancer. So I got the rush report, $550. I figured, well, I really need to do this and do it fast. And what I came up with, or what he came up with, were two top treatments, one in Korea and the other in Japan. Well, how do you like that? What do you mean there's no better treatment? There's nothing we can do, and there's nothing anybody else can do. Don't believe that stuff. Just don't believe it. Now, I called a doctor in Korea, and I spoke to him. Not an easy task, especially if you don't speak Korean, and the secretary doesn't speak any English, and they give you the wrong phone number. But there is a way. There's always a way. So, I found a Korean doctor, a psychiatrist who worked in Port Ewan, who lives in Highland, who not only got the same kind of message when he spoke to the doctor's office, which is he's not here and we don't have a phone number for him, but this is synchronicity, or some people call it coincidence. This guy, this doctor, Korean doctor, had a doctor himself, an internist over in Poughkeepsie, who was a friend and a classmate of the doctor in Korea who had the cancer treatment. So he was able to get the guy's home phone number and the private line into his office. And he called him, and he spoke to him. And what it was about was, what it finally came down to was that I wasn't a candidate for this kind of treatment because I had extensive chemotherapy previously, and that's what his treatment was. It was just a different kind of cocktail, delivered in the same old-fashioned way, which is intravenously. So I tried Dr. Maeda, who was in Kumamoto, Japan. I called him. I got his secretary. I asked for Dr. Maeda, and she said, "Just a minute, please." In Japanese, that's "chatamate kudasai," in case you have a need for it. And I get Dr. Maeda on the phone, and he got his MS in science at the University of California at Riverside. He spoke perfect English. I said, "Wow, okay, we have a connection here." He said, "Send me your medical records, send me your latest CAT scans. I'll fax you a letter and let you know what I can do for you." I sent it off, Federal Express. Don't send it through the post office. They tell you in the post office that express mail, global mail, gets there in 3 days. It's not true. It takes a week. FedEx, 3 days, it's there. He faxed me back a letter. He said, "Yeah, we can help you." And so at that point, I called friends. I said, "I need your help. I need you to access this doctor's website. I need information about his procedures. I need to know about the process." Had people who were working 8, 10 hours downloading articles. It turned out, I mean, he's got over 300 articles on this treatment in refereed journals, no American journals, European and Japanese, over the last 4 years. And it's not just him, it's him and his group. So what is this treatment? It's called macromolecular therapy. And there's a lot I don't know about it. But let me tell you what I do know about it. Because the reason I went to Japan was because it made sense to me. And because I had a lot of information. And it's not just for gastric cancer. It's actually used and approved in Japan originally for primary hepatomas, liver tumors, and then got subsequent approval for other soft tissue solid tumors, pancreas, stomach, abdomen, bladder, colon. I don't know about breast. You know, the way chemotherapy works, you probably know how chemotherapy works. It targets fast-growing cells. That's what I said before. So not only is the digestive tract involved with fast-growing cells, but so are the cells that we call cancer cells. They're fast-growing. So when we inject chemotherapy, we're out to kill those fast-growing cells. Unfortunately, the immune system, which is also fast-growing, the T cells, the NK cells, the macrophages, also suffer and become debilitated and killed off, and that's why the white blood cell count drops so far. The treatment that I got is called SMANCS. It's SMANCS. SMA is, and I have it in my letter that I wrote that I hope all of you have gotten a copy of. It's styrene malic acid, which is a polymer. It's what they use to make contact lenses, only it's in liquid form. And that's bound with a cytotoxin called neocarzostatin. And I understand less about that than I do about the styrene malic acid. It was all, stuff that I never encountered any of that. They bind these two molecules together and they make a macromolecule, a large molecule. Cancer cells, somebody, I think it was you, Audrey, you talked about, what was it? Well, you were talking about the learning what cancer cells didn't like. Okay, so it was heat, and so it's not just what they don't like, it's the characteristics of the cancer cells that you have to come to know. So one of the characteristics of cancer cells is that they're 4 times the size of normal cells. They eat 4 times as much as normal cells. They are voracious. They will eat whatever you give them to eat. So by making a macromolecule, binding the polymer to the cytotoxin, they created something that couldn't enter a normal cell because it was too big. But it can enter a cancer cell if it has the right code to get in. So there's something in the characteristic of the polymer that does that. It has the code. It can open the cancer cell and get the substance in, the medicine in. What it's carried in, what these two things are carried in, is something called lepiodol, which is like a vegetable oil. And I think of it as like a little boat carrying the polymer and the cytotoxin through the cancer cell right into it. Now, the way they administer it is another story. It's intra-arterial. So they thread a catheter, a tube, from the groin to the site of the tumor. And they inject this SMANCS lepiodol medicine into the catheter. It gets up to the site of the tumor, but it doesn't get injected into it. The polymer opens the door, it goes in. Once it's inside, everything splits. The lipid lepiodol becomes like a vegetable glue-based glue. There's a split between the polymer and the cytotoxin. The cytotoxin gets released into the tumor and gets held in place by the glue. and the polymer stimulates production, or stimulates the immune system. So rather than being an immunosuppressant form of chemotherapy, it's actually an immuno-enhancing form of chemotherapy. Okay, would this work? I said, gee, this is simple and very elegant, and I don't know the first thing about it, and nobody can tell me about it. The doctors at Sloan Kettering couldn't tell me anything about it. Nobody knew anything about it that I had come into contact with. I said, I'm going. Guy thinks he can help me. These are honorable people. This was all gut level, right? And I had a third of a gut left, so I figured I might as well use it and use my intuition. These are honorable people. These are honorable men, doctors. I went there in September of 1998, and went with my son. I was kind of weak. I was re-diagnosed, with a recurrence in April of '98. This was now September of '98. So I'd lost weight. I was weak. I knew I didn't have a whole lot of time or energy, and this was my last shot, my last best shot. I was going for 9 weeks because I was expecting to get 3 treatments. And both my wife and I, independently, we never said this to one another before I left, felt that I might not come back. Because who knows? You don't know what's going to happen. So we get to Japan. They sent a car to the airport, pick us up. That was easier said than done, actually. I said, we get to Japan, and they sent a car for us. It took us 3 days to get there. And that's a whole other story. But we get to the hospital on a Wednesday afternoon. They do a CAT scan, they do blood work, they do the sonogram. Everything was done within about 2 hours, and then the next morning they did the treatment. I mean, it was bang, 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 no waiting, no muss, no fuss. And then the hardest part of it was lying on my back for 20 hours without moving. Because if you move, the stuff splashes around, and the medicine can kind of splash out of the tumor instead of being stuck to the glue. So it has to gel. It takes 20 hours for it all to gel. And the first treatment, I freaked out. It was emotional, and it was the side effects, as they turned out, were very mild. I had a very mild fever, no real after effects. I was up and about the next day. I was eating. In fact, the last time I went, which was in April, I didn't have that kind of bad experience, and I was released from the hospital a day and a half after the treatment. That's treatment is still to be evaluated. Basically, what the treatment did for me over the past almost 9 months, 10 months, was to stop the tumor's growth. Because it's roughly the same size as it was when it was found in April of 1998. It grew a little, it shrank a little, it grew a little, or maybe it didn't change at all, because it's not that easy to be clear and certain about the size of a tumor reading a CAT scan. I mean, there was a radiologist, folks, who didn't see a 10-centimeter tumor. What a jerk. It cost me 4 months. 4 months of being misdiagnosed. I could have gotten treatment 4 months earlier. I might have had a smaller tumor. Who knows? I think it's when you get to the point where you fear cancer more than you fear the doctors, that's when you act. That's when you do something. That's when I was out on my own, and there we were in Japan, and the second treatment was better, and I was expecting to have a third treatment, and they said, no, we're not going to give you a third treatment now, but we'll follow you. So I got CAT scans, I sent them the reports, I'm not getting any treatment here in the United States. I'm not taking vitamin C or germanium or any of that. I do watch my diet, but I do eat red meat. I eat pork. I eat all the stuff that makes people shudder at the thought that if I don't eat well, or if I don't get rid of all the toxins in my house, or if I don't, then I'm certainly going to die. And maybe that's true. I really don't know. But you know what? Nobody else does either. Nobody else does either. So my philosophy, as it were, my mindset is you got to be strong in your mind, and everything else will come with it. And I just want to read something to you that I wrote, and I'm going to finish. When I got to Japan this last time, it was my credo, if I can find it. This is before I had the second treatment. I arrived on the 11th of April, and there I was in this guest house, tatamis and futons and all that. Nice place to stay if you want to go to Kumamoto, Japan. You are here. Don't despair. You came, you saw. Your goal is to conquer your fear, your cancer. Don't doubt. Don't worry. Don't back off. Be brave. Be upbeat. Be humble. Be outrageous. Be dignified. Be a warrior. Thank you.